Hi everyone, my name is Jessica Svetic and I am PA and co-owner of Citrus Aesthetics in San Diego, California. I've been trained internationally by some of the best injectors and have utilized techniques and combined techniques in order to address every one of my clients' unique goals. So I have my beautiful model client here today, Emma, and I'm just going to demonstrate a couple of things for teaching other aesthetic providers how to take a really safe and natural approach for lip filler. And it really is going to be something where you hone in on what your client's specific goals are, what is their anatomy, and how do you combine the two in order to get best and most natural results. So when I first evaluate Emma, I see that she has a beautiful natural Cupid's bow. And so what I want to do is basically just enhance her anatomy. I'm going to use a combination with Emma on utilizing both vertical injection points, very small retrograde injections, starting at that JQ point of the Cupid's bow. What the vertical injection points allow me to do is build up vertical height. She also, she's of Caucasian descent, so I keep in mind ratio of her lips, and right now she's naturally about a 1.4 on the bottom lip to about a 1, meaning that her height is a little bit less on her top than her bottom. And so, you know, sometimes patients have goals in order to change that ratio. Sometimes people want more of a 1-to-1 ratio, which would be more a natural, actually what African Americans are born with, a 1-to-1, or even sometimes a 1.2-to-1, which would be a larger lip on the top than the bottom. So again, evaluating and asking and really taking your time with your client to figure out what their goals are. So I would be doing vertical injection points starting right at that point of the Cupid's bow and then working my way lateral. So what I don't want to happen is too much in this medial tubercle. What I really want to focus on, and I'm going to zoom in here so that you can really be able to see her lip anatomy as well. So what I don't want to do is focus too much filler on this middle portion. So I really start in this lateral tubercle here and start building up vertically. Now, she has a little teeny bit of an M shape, not too much, but you can see just a slight dip here and then a curvature up. So I can actually bring more height and a more natural feel to the lip by addressing this very slight M-shaped lip that Emma has by doing what's called a lollipop technique. So when I inject, I stop at the wet to dry lip mucosa border. I inject a small amount of product without moving the needle, and then I do a retrograde injection up. And that'll help actually create a more linear line here, building up that lip naturally. Once I've built up that volume and height here, then I want to go in and just do a very small amount of fanning technique, utilizing very thin and small retrograde injections again, just to build out a little bit of volume in this lateral tubercle, but I don't want too much anterior projection at all. So keeping a very natural look and feel. When I work on the bottom, I don't directly start in that middle portion here, but what I want to try to do is starting just a millimeter lateral on each side of that middle point and injecting again up vertically. And from my last point, occasionally I'll fan out. On her, I really don't need much volume. She's got really great plump lips to begin with. You can see that she doesn't need much extra moisture. So in order to maintain a very natural look, I want to do a minimal amount of filler. One of the most important things that I want injectors to understand is that your value is not in how much filler you're using. It's really in addressing your client's goals with just the right amount of minimal filler in order to achieve very natural results. And that does not mean that a whole syringe goes into the lips. It's really utilizing very small amounts in a very precise way in order to get that very natural enhancement. So I try not to talk to my clients about the amount that I'm using, but really targeting their goals to get very natural results. One other thing that I want to note is that in evaluating a client and evaluating anatomy, two of the most important anatomical references in addressing the lips is the superior labial artery, which typically in most people, and there are anomalies, but in most people, I'm going to be lifting the lip and I can actually visualize a palpation, visualize and palpate a pulsation of that artery. So I'm lifting up, looking at that wet to dry mucosal border, and I actually see a little bit of a pulsation with the light reflex. The other way, right at that wet to dry border, I'm palpating, and I can palpate that superior labial artery pulsation as well. And it's pretty far back on Emma actually. So I know to stay very superficial, and that way I will not be impacting that artery at all. When I do any kind of filler, I'm thinking about how to minimize the risk of getting my filler into a blood vessel, because if it were to get into a blood vessel, that leads to something called a vascular occlusion. This is treatable, but some signs of a vascular occlusion could include immediate paleness of the skin, followed by pain, swelling, skin changes, and a reticular pattern of the skin, meaning kind of like a white and white and red kind of lace-like pattern, which is called levator reticularis. And so if any of those signs happen, it would be crucial in a timely manner to treat with a product called Hylenex or hyaluronidase. And anything ending in ASC is an enzyme that eats up the hyaluronic acid. And so this is something that we basically utilize 3 techniques in order to minimize that risk, which is understanding anatomy and evaluating anatomy. It is a low extrusion force, so using very small amounts in a low volume of speed. And then third thing is in the lips, knowing where to place your needle, so superficially and above, and in other areas of the face, really also understanding those points where you shouldn't be directly on the bone or where you can also be aspirating. So those are a few of my techniques in order to minimize risk of vascular occlusion. In summary, when evaluating the lips, you want to start off with evaluating the anatomy. You want to really have in-depth conversations with your clients about what their specific goals are, if they've had any poor procedures or outcomes in the past, and really being able to address that. And then third, really evaluating what their ethnicity is and how that aligns with what their goals are. And utilizing both vertical injection points strategically and precisely to get that vertical height, along with horizontal injection points to get a very natural and minimal anterior projection. And I also utilize some techniques that I've been trained on with other providers, really building out triangles, because triangles are the strongest shape in nature, as well as when we're using an art form with filler. So if I'm doing one injection point on Emma and I end up using a triangle form, so injection point here and a fanned triangle form, that's really going to build structure. And if I repeat that right next to it, again, a really strong form, triangular form, to build structure. So that's another nice technique that I utilize. If you are interested, if you're an aesthetic provider and you're interested in training with me here at Citrus Aesthetics, I've trained dozens of solo providers. I train everyone one-on-one so you can really get insight into both the business operations of running a clinic and the ins and outs of operations, as well as all of my training that I've had. I love to be able to educate, inspire other providers to get really safe, natural results and to be confident in your injections in order to get your clients' best results. So you can go to my website, citrusaesthetics.com, and go look at the Citrus Training Academy page, or you can DM me as well on Instagram. Give me a follow on Instagram at citrus.aesthetics_, and I can't wait to help you become the best provider possible and to give you you and your clients best results. Till next time. Did you find this information helpful? Like this video, send to a friend, and don't forget to subscribe. Can't wait to see you next time to learn more about Citrus Aesthetics and really valuable natural results for aesthetics. See you next time.